want to introduce today's speaker, Dr. Lin. I'm very glad to have this opportunity to invite Dr. Lin to give us a talk today. And Dr. Lin was physical therapist in Taiwan. She is PT background, and she got her degree from from China Medical University, and she got her master degree in University of Texas and Austin. And she was graduate from University of Oregon for her PhD degree. So let's give a big hand to welcome Dr. Lin. Thank you.
Thank you, Professor Tai. All right, thank you for having me here. And my name is Fang-Yu. So I would like to share the topic about supporting early childhood social-emotional development and positive behaviors. And since many of you have been working in the field of rehabilitation science, so I hope we can have conversations about how this topic can be applied to your field and to your work. So everyone can, oh, I need to share it. Can I share it? Can everyone see the slides? Oh, already. Okay, good.
Yes,
good.
yes.
All right. Okay, so all right, so I think Professor Tai just talked about this. This is my brief history. So one thing I just want to add is that I'm also a board certified behavior analyst, and I got this license in Texas. And so, yeah, so I'm pretty familiar with applied behavior analysis, and I work as a BCBA in Austin for a while before I started my PhD program. And I'm a postdoctoral researcher right now in National Normal Taiwan University. So, okay. Yeah, so as you know, I am working remotely, and thanks to the technology, we can all talk online like this. So let's begin our topic today. First thing first, let's think about why is early childhood social-emotional development so important. And I would like you to think about it for about 1 minute. And I hope somebody can share their thought about why this is so important. Any thought will be appreciated. And how do I know? Maybe you just unmute yourself and talk. Maybe that works. Oh, I saw somebody put in the chat. Happiness. Yeah, of course, happiness. This is a very direct and simple answer. Good. Anyone else? You can share it on the chat. I can see it. Or you can just unmute yourself. Okay, someone said, cognitive development that help the baby connect with the society. Oh, that's good answer. Good job. What else? No. Okay, 3, 2, 1. Nobody? All right. Okay, so there are many reasons why the early childhood social-emotional development is so important. One thing, this is important because it is the foundation for learning. That means that if you want to learn something new, you need appropriate social-emotional development to learn it, to adapt to the environment. Many research show that social-emotional development can predict academic performance, school readiness, and overall well-being. So social-emotional development is a functional process that you need to adjust yourself and adapt to the environment and learn new things. Okay, let's talk about what social-emotional is. So it is a functional process I just talked about. It is a process that enables the person to adapt to and interact with environment. Social emotional development can be divided into two major domains, social competence and emotional competence. So social competence is a series of behavioral skills that enables a child to interact, respond, and build positive relationships with others. And emotional competence is the ability to regulate emotions, to adapt to conditions, and to achieve one's goals. Okay, so this is kind of definition for those competencies. And let me give you some examples. So when a child is able to ask for help when he needs to reach a toy on the shelf, do you think it's a social competence or emotional competence? Type your answer. Is it social or emotional competence? When a child asks for help when he needs to reach a toy on the shelf. Social. Yeah, many people choose social. Exactly, yes. So social emotional, as we talk about it, is a behavior, a serious behavioral skills that we need to use to interact with people and build positive relationship. So in this example, asking for help is a critical social competence skill. And another example is that when it is the first day of preschool, a child cries immediately when his mom drops him off at the school. But then, after 15 minutes, he's able to calm himself within the 15 minutes. So do you think it's social, emotional, or social competence or emotional competence? 3, 2, 1, type your answer. Or you want me to say it again? Oh, great. Emotional. I see somebody. Great. Emotional. Yeah, so calm himself within 15 minutes is a skill to self-regulate himself. So this is an emotional competence. Okay, so let's look at this picture again. So we know that there are two domains, social competence and emotional competence. And there are other development areas that they are intertwined together to influence social emotional development. So as you can see in this picture, this is a process intertwined with other development areas, especially language and cognition. And it also can be influenced by culture. For example, different cultures have different expectation for a specific behavior. Like some culture does not prefer have eye contact or body contact, but some cultures, they prefer body contacts, for example, hugging or kissing. So culture plays important role in social emotional development. Okay. Let's see, next slide. Right, so to better understand and measure social emotional development, we can observe the behaviors in these 7 areas. The first one is the self-regulation. Self-regulation is ability to calm or settle down or adjust to environment and conditions. The second one is compliance. Compliance is a ability or willingness to conform to the directions or following rules. Adaptive function means the ability to cope with physical or emotional needs. And autonomy is the ability or willingness to self-initiate without guidance. Affection is the ability to demonstrate his own feeling and empathy for others. And social communication is the ability to use verbal or nonverbal signals. And interaction with people is the ability to initiate or respond the social signals from others. for example, parents, siblings, or adults, or other peers. So these are the key areas that we want to observe the behaviors to measure social emotional development. All right. So in Taiwan, the prevalence study, a previous prevalence study done in 2020, shows that about 1 in 4 school children have been experienced mental health disorder. So in this study, these researchers used questionnaire and interviews. They interviewed more than 4,000 students in Taiwan from 3rd grade to 7th grade. And they evaluated their mental health condition according to DSM-5. And the rate is about 20 to 30%. Do you think it's higher than you expected or lower than you expected? High or low? Do you think this rate is high? Okay, right. So 1 in 4 school students may have a mental health disorder. So many people say, okay, some people say high and some people say low. Okay, right. So actually it's pretty high compared to other countries. So let's see. This is the prevalence estimates in the US for different age group. So we just talked about the 3rd grade to 7th grade in Taiwan, right? So the similar age group is like 15% or 13% in the US. And another study said that the prevalence rate in Japan is about 18%. So in Taiwan, this prevalence rate is quite high, and we are not sure why, but it means that we need to act earlier. So, okay, so let's talk about why understanding prevalence rate is so important. Why this is important? Why do we need to know this rate? Or think about knowing this number can help something or can do something. Does anyone want to share your thought? And I want to let you know that many questions does not have the correct answer or the only answer. So just share your thought. Oh, okay, I see somebody said early intervention. Awesome, that's right. So one of the reasons is that we need to know the prevalence so we can identify those kids earlier, early identification, and then we can do early intervention. Yeah, so this is one of the reasons. And another reason is that we can increase public awareness. We can let many people know that this is a problem. Okay, someone said knowing the prevalence may predict the consequential outcomes. Yeah, that's right. Yes, this is one of the reasons this is important. Thank you for sharing. Yeah, so there are many reasons, and yeah, all of your answers are great. And another reason is that this also help policy to make modification. So for example, if the government noticed that the prevalence rate is going up, that means something is wrong. So they need to look back at their system, look at their policy, their rules, to see what's going on in their environment and what should we do to improve this kind of situation. Okay. And the prevalence rate will be much higher for children with disability or development delay. So previous studies showed that children with developmental delay or disability are 3 to 4 times more likely to have significant social, emotional, or behavioral problems. And the risk may increase over time without intervention. So, okay. So as you know that you all work in rehabilitation science, especially some people are working with child, you're probably in the field of early intervention, and you are working with those kids with special needs. So these kids are probably and more likely to have significant social emotional problems, and they need to be monitored over time because the risk may increase if we don't respond in time. And also, sometimes the behavioral problem will be worse and hard to be improved when they grow older. So we want to act earlier. We want to find those kids with at risk, and we want to act. We want to provide intervention earlier when they are very young. For example, like just 2-year-old, 3-year-old, and so we can kind of make their social emotional development back on track. Okay, so regular social emotional screening is recommended for children with developmental delay or disabilities. I know that it's not very typical in Taiwan to do the social emotional screening regularly. Right now, I only know that Taipei 2, they do have some social emotional screening items. And I think it's just few items for one age interval. But in the US, they have a whole screening tool just for social emotional development. They do it because that they find it is not sufficient to have just few items to screen the social emotional development. They create another tool and screen it with like 30 items for young children. Okay, so this is the link system. As we know that the screening is very important. It is also the first step we need to do for early intervention process. And the link system is the base of the early intervention system in the US. I think it's also similar in Taiwan. So the first thing we do is to collect information from screening and assessment. And then we summarize those information and plan. For example, we have the individual education plan and we have individualized family support plan. And then we have a plan. We can implement the intervention. For example, we have the curriculum, we have the therapy approach. And then we implement, after we implement the intervention, we need to evaluate how it works and how the child progress over time. So this is the link system. And in this system, the family play a critical role in the system and also in the social emotional development because family is the first environment that the baby interact with. And based on the Bromford-Brenner ecological system theory, the family is a part of the microsystems and the mesosystem. I would like to ask, how many of you heard or know about ecological system? Do we have raising hand mark here? No, there's no raising hand. Okay. Oh, I see somebody. Oh, okay. Oh yeah, so someone gives the thumbs up. Okay, so some of you have heard about ecological system. Good. All right, so this is very important theory that, or this is the philosophy of the early intervention in the US. So in this theory, the microsystems include the family, include the parents, include the siblings, include the childcare and early intervention. So everything that directly interact with the baby or with the child are the microsystems. And the mesosystem is the interactions between these microsystems. For example, parent-teacher collaboration, parent and the professionals relationship, or the collaboration between the teachers and the therapist. Those are the mesosystem. So family plays a very critical role in this system because, yeah, as you can see that macrosystem and mesosystem has to work with family. And those are the key ingredients in this linked system. From the screening to planning, every step should include family and include the interdisciplinary collaboration in order to support the social emotional development. All right. So because family is so important, this is the screening tool we used in the US. It is called ASQ-SE2. It is widely used in many states in the US. Actually, I just complete one for my daughter because her school required parents to complete regularly. So this is a parent-completed questionnaires, and it can identify young children at risk for social or emotional difficulties by screening 7 key behavior areas we just talked about. So I don't know how many of you have heard about ASQ-SE or ASQ. You can use your thumbs up or you can just. Nope. Okay. So how many of you have seen the social emotional screening items in Type A2? I think this is the most common screening tool that is used in Taiwan. Nope. Okay, that's okay. So let's talk about it. Okay. So having parents complete the screening is very helpful for us to identify the risk from their perspectives because they are parents, they live with the kid and they can observe them every day. They know their typical behaviors at home. So this is a very important information resource that we can get when we screen social emotional development. And it also has the Mandarin Chinese version in Taiwan. Let me show you the oh, here, I just put it here. Oops. Okay. No. Oh, here. So this is the Mandarin Chinese version for ASQ-SE2. If you are interested in it, you can search it online. It should be available. Okay. And I would like to show you a sample page of ASQ-SE2. This is the summary page of the ASQ-SE2. Oops. No. I think I cannot drag the, okay, I cannot drag it. I can just, okay. All right, so this is the sample page of the summary profile. So as you can see, this is for 24 months information summary. And after they complete, the questionnaire, they will have the scoring chart. I think many of you are familiar with scoring and looking at the cutoff score. And ASQ SE2 work the same way. So after you look at the cutoff score, your score, the screening score will fall under one of this category. The first category is no or low risk. The second category is the monitor area. So that means that the child is very close to the cutoff, but it's not higher than the cutoff. So we need to monitor it and see how he progress next time. And when the child score is higher than the cutoff, it will fall under the referral area. That means the child needs the further assessment with professional. Okay. And after we determine the score, there is another area here for parents and the professionals. They will talk about the overall response and concerns the parents have for this child. For example, the professionals may ask that, is there any concerns, or is there any problems with eating, sleeping, or if you have any worries, that you can mention it here. And the professionals can write it down and mark it for further assessment. And then after it, there's a follow-up. How do I here? Okay. There's a follow-up referral considerations. So in this page, after they summarize the information they have, and then they will discuss how they are going to do next. So if the child is fall under the referral area, then there are this is necessary to refer it to further assessment. And we need to consider the following factors. For example, is there a setting or time factor affecting the behavior? So for example, we would like to know the child's behavior is it there's a difference between homes or school or in park, or is there a different behavior, or is there a bit different conditions you observe on this child? And also we want to mark that if this child has a development delay in some of the areas, for example, does the child has language development delay or cognitive delay. And also we want to mark if the child has health issues. For example, the child is the preterm baby, or is the child has some other disease. So these are the summary page, and this is very important for the further planning, which is the second step we usually do after assessment and screening. So this is also where we probably will notice some of the challenging behaviors, because when you talk about this overall social emotional development after you complete the questionnaire and talk with the professionals, the parents may think about the child's behavior during daily lives, and they probably will describe how their child behave in some of the settings or conditions. So this is where we usually observe some challenging behavior that parents want to address. And if the challenging behavior is significant and impact their lives or impact their learning, then we need to address it. Okay. And how we addressed it. Here are some terms. Applied behavior analysis. How many of you have heard about applied behavior analysis? ABA or yeah, ABA, applied behavior analysis. How many of you heard about it in Taiwan? Okay, I see somebody thumbs up. Good. Okay. And all right. Okay. And how about positive behavior intervention and support? PBIS or PBS? Does anybody heard about it? Oh, okay. I'm kind of surprised. I thought many of professionals in Taiwan are more familiar with PBIS. Okay. All right. And how about competing behavior pathway or acting out cycle or escalation cycle? Or have you seen any of this kind of pyramid, saying tier 1, tier 2, and tier 3, or this kind of figures? Okay, I think it's very quiet now, so no one I think no one has heard about this. Okay, that's okay. We are here to kind of know what are they. Before I go into next slide, I would like to just let you know that they are basically the same thing. The positive behavior intervention and support, competing behavior pathway, and acting out or escalation cycle, those things are based on applied behavior analysis. So the ABA is the foundation for those three things I mentioned here. Okay, so we are just going to talk about ABA. Applied behavior analysis. Applied means that we only focus on socially significant behaviors. What is the socially significant behaviors? Let me give you some examples. For example, saying thank you when somebody helps you. This is socially significant behaviors. And how about if we want to teach a dog how to count? Do you think it's a socially significant behavior? Teaching a dog to count. Is it a socially significant behavior? Yeah, right. No, I mean, many of you say no. Yeah, so socially significant behavior means that it is socially important to this individual. So is counting important to the dog? Obviously, it's not. It's not important to the dog, and it doesn't have to learn about counting. Although it can learn about counting, but it does not have to. But socially significant behavior has to be the behaviors that impact their daily living. For example, brushing teeth or having appropriate hygiene, or washing hands, or dressing, or prepare food, or go shopping. So those are the socially significant behavior that are very important for an individual's life. So apply means that we only focus on socially significant behaviors, and those behaviors are meaningful for one's life and relevant to their daily function and overall well-being. And the behavior here means that it has to be observable and measurable. So let's give you example. Okay, for example, looking at your iPhone, the number of times you're looking at your iPhone, is that a behavior? Yes, yeah, that's right. So it is observable and measurable. You can measure how many times you look at your iPhone when you are working, right? And you can also measure how many times you go out and work out. And you can also measure how long you spend on your homework before the deadline. And yeah, so those are the observable and measurable behavior. And those are the things we want to focus on in ABA. So how about if I say we want to measure one, okay, let me give you an example. So we want to know how focused is the child. Do you think it's a behavior that we can measure or observe? If I just say, I want to know how focused the child can be. Or say, I want to know how this child can pay attention to a task. Oh, that's really cool. Someone said using the eye tracker. Okay, so that's interesting because when we talk about the behavior, we have the definition for that behavior. What I just said, when I just said pay attention to a task, I didn't give a very clear definition to this behavior. So when there's no clear definition, we probably cannot observe or measure because we don't know what to measure. But as this one, I think is Po Ching Huang. I think this is a great idea because you talk about the eye tracker. So the definition for the paying attention or being focused can be how much time the child look at the task. So this will be your definition of the behavior. And then you can use the eye tracker to measure the duration of looking at the task. Yeah, so behavior, when you want to measure a behavior, you need to have an operational and clear definition to for this behavior that you want to measure. This is the applied behavior analysis. Oh, it is also a science. So we want to have data to track, to see how this child progress on this behavior. And then the analysis, just like what I just said, this is the science, and we sometimes will do experiment and to test if the behavior change between conditions. So for example, we probably will want to experiment that if we give them this one A condition and B condition, different condition, will the behavior change? If the behavior change, then we know that the factor in in a condition is impacting the behavior. So we can have the intervention to intervene that factor and change the behavior. So ABA is a science. It is data driven. Okay. All right, so when a child has a significant challenging behavior and it started to have ABA or BCBA to intervene, and the first thing we usually do is to conduct a FBA, functional behavior assessment. This kind of assessment usually include the indirect assessment, meaning that we probably will give them a screening tool and having interviews or the questionnaire to understand that how the behavior look like in their settings in their daily life. And then we, based on the indirect assessment information, we probably will conduct the direct observation. We take data, just like we just talked about, that we measure the behavior in the setting. For example, we probably want to go into the school or going to their home and observe the behavior directly and take data to see how many times or how the behavior look like in this setting, and also take data on the duration or on their oh, the word is just slipped out to my mind. Okay, so we take direct data and observe it when we have the target behavior and it is defined operationally. So the next step, if we still cannot figure out what's going on with challenging behavior, we will do the functional analysis. And this is the experiment part. Just like what I just kind of mentioned about it, we will test how this behavior changed between conditions. And this is usually done by BCBA, not by teachers or the assistant. So functional analysis is kind of, if the challenging behavior is dangerous, then the functional analysis will be dangerous as well. So FBA usually can be done by direct observation. Then you can pretty much know what's the reason behind this behavior, and then we can provide intervention to change the behavior. But when the behavior is quite complicated, then they will ask behavior analysis to come in and have the functional analysis. They need to test the reason behind this behavior. Okay, so this is the general idea about FBA. When we complete FBA, we will have a behavior intervention plan, which is the BIP. And we will have the function-based strategies to address this challenging behavior. And usually it will focus on prevention and also support the positive behaviors to replace the problem behaviors. So the BIP, the goal of the BIP is usually to increase replacement behavior, which is the appropriate behavior to replace the problem behaviors. And we want to focus on preventing the challenging behavior instead of just decrease the challenging behavior. We want to prevent it and have a new behavior to replace it. Okay, so the BIP will usually come into the planning during, for example, when we are planning the IFSP with the family and other professionals. Okay, so now probably you will kind of confused. Why do I need to know? Why do I need to know BIP or FBA or what ABA whatsoever? Why do I need to know about this as a practitioners in rehabilitation science? Does anybody want to share your thought? Do you think it's why do you think it is tools? Oh yeah, it can be a useful tools for you, right? Even though you are not the one to conduct the FBA or you're not the one to implement the BIP, you still can use it as one of the tool in your practice. And also, let's look at this picture again. Okay, look at this picture again. Social emotional competence. It is intertwined with many development areas, right? And let's look at this picture again. All the things are based on the ecological system, and the meso system is the interaction between microsystems. So after looking at these pictures again, do you have any other thoughts? Why do you think we need to know about those terms and social emotional development? Okay, someone said, understand what limits the function of participants. Yeah, right. So it helps you to understand the other potential reasons why this children is not functioning as we expected, right? We need to consider a lot of things because child development is a holistic thing. It's not like, oh, I'm a physical therapy, I only look at the motor area, and I'm an occupational therapy, I only look at the fine motors, and I'm a language, I only look at the language. Okay, so we can know their limitation or try use other approaches. Oh, I like your answer. Yeah. So this is kind of very open-minded, and this is a great mindset to collaborate with other professionals. Thank you for sharing your thoughts. Yeah. So as you can see, that collaboration is very important in early intervention in the system because of the ecological system theory, and also because that social emotional development is so complicated and intertwined with other development area. So we cannot just only look at social emotional development because it is impacted by other development areas. So when we talk about social emotional development, we need to consider a lot of things, not just using one tool or not just looking at one perspective. So this is why in the US, many states, the service model in many states are the primary service provider, which means that one early intervention team will pick one provider for a specific child, and the provider, for example, if the team has the PD, OT, ST, psychologist, and or nurse, many people in the team, and they probably will pick one that that can better fit the child's need. For example, this child is a child with cerebral palsy, then the PD probably will be picked as the primary service provider. However, although the PD is the primary service provider, other professionals has to coach this provider, which is PD. Other provider, for example, psychologist, for example, behavior analysis, or OT, they have to coach this PD to provide other service and embed those intervention in the PD therapies. So the children will usually only interact with the PD if it's a primary service provider, and the children will have a holistic or very consistent intervention plan. So this is quite different from Taiwan because from my experience is that children usually goes to hospital or goes to clinics, and they have, for example, on Monday he has PD class, on Tuesday he has OD class, and probably on Wednesday that he probably has ST class. So it is quite different from the US. In the US, they probably just have one primary service provider going to their house and provide all the therapies the child needs. So this is why they often address social emotional development across all those service plans. They embedded the social emotional techniques when they provide their services. All right, so when you work as a professional in Taiwan, even though they do not use this kind of service model, you can still have this kind of knowledge or general idea about social emotional development and also about behavior. Then you have this idea, then you can embed some of the techniques in your therapy. For example, some of children, they cry every time when they get into the therapy room, or they cry, or they have tantrum, or they throw things in your therapy room. And those challenging behaviors you may want to address, because if they always have this kind of behavior and they always cannot cooperate to your therapy, then the therapy is not working. You cannot do it when the child is having tantrum. So having this kind of knowledge or general idea is very helpful for your practice as a professionals in rehabilitation science. All right. Let's see. Okay. Yeah. So collaboration is the key to more holistic and consistent intervention. And when we want to provide a very consistent intervention, you need to know the information from other professionals. For example, if you are the OT and you don't know how to interact with this particular child when he has a challenging behavior, for example, kicking the door or kicking the toys, then you probably want to talk with other professionals if the child has behavior therapy, or if the child has the psychology therapy. You will want to know what kind of services the child is having, and you want to know the information and to understand that how to react when the child has this kind of challenging behavior. Because think about it, if everyone react differently, for example, the teacher react this way at school, the parents react this way at home, and the OT react this way in their therapy room. Everyone react differently. Do you think the challenging behavior will improve? No, it's not. It's kind of not possible, or the challenging behavior will always persistent in one condition. So if you really want to improve one of the challenging behavior, we need to make the service and the intervention plan consistent across the settings. The parents needs to know, the teacher needs to know, the therapist, early intervention practitioners needs to know the same way to react to challenging behavior. So the kids can receive the same message from the adults, and then they can so the behavior will change. All right, so collaboration is the only way to make it happen. And another thing is to support the family, as we know that family is one of the team on the early intervention team. So supporting the family is also critical. We would like to use the family-centered intervention. For example, you need to know the priority of the family. You need to understand their cultures, and you need to understand their expectation for a behavior. So you can so you know that how to address it in your service plan. And you also want to use the relationship-based practices. For example, your plan is focusing on parent and child relationship. You want to teach the parents how to appropriately interact with their child. And we can talk more about it after this slide. And you can also provide some parent education information or support. And then if it's needed, you may want to know their home environment. Usually it's done by the social worker. If social worker is on the team, then you want to look at their report to understand their home environment and think about that, how your intervention can be embedded in this home environment. And the last thing is that we need to have cultural competence, which means that we are aware of the cultural difference, we respect that difference, and we consider it, how to address the cultural difference in the intervention, so the plan can work for this family. We want to think about what works for this family, but if we only talk about what works for us as a professional, so it's not gonna work for the kid and the family. So for the social emotional development, this is particularly important. All right, I'm going to talk about some general advices that you can give to families to support their children's social emotional development. The first thing is to understand, serve, and return. The second thing is to read with child every day. Let's talk about serve and return. Does anybody know about or heard about serve and return? Or does anybody play tennis? Tennis ball. Okay. All right, so serve and return is the turn based on tennis game. So the player will serve the ball to another player, and another player return the ball. So that's the serve and return. And imagine that serve and return is the process of how we interact with child. This idea is introduced by the Child Development Center in Harvard. And I think you can see, there's a website link. If you are interested to learn more, you can click this website link. And they talk about the theory of serve and return. It is important because that during early ages, like 0 to 3 or 0 to 6, the brain develops quickly during this age, and the serve and return is critical to connect to facilitate the connection in baby's brain. So this is very important to help the baby, to improve baby's brain development. So let's talk about the steps of the serve and return. The first step is to notice the serve. So we need to know the baby is initiate the response and initiate a social signal. That means that we notice the serve, and then we share the child's focus of attention. So for example, a baby is turning her head to a direction, looking at something. That is kind of the social signal. And then we can share the same attention. We look at it the same way, and then we can return the serve by supporting and encouraging. For example, you can say, oh, you are looking at, and then we give that name. For example, the baby is looking at an airplane, and you can say, oh, I see you are looking at an airplane. And then we take turns, and we wait for baby's response. So this is the serve and return idea. We can model how we do it during our therapy. For example, when you are working with a kid in your therapy room, and then you can model how you interact with this child using the serve and return, and then you can show parents how they can do it at their home, and tell them that serve and return is very helpful to develop a baby's brain and also facilitate their language development. And another advice is that one book a day. A study showed that no, it's not previous, it's recently, I think it's 2 years old, 2 years ago. The study showed that when you read a book a day with your child, there's a significant difference between one book a day and not one book a day group. So the difference in the language development is very significant. The baby or the child, they read with their parents one book a day, they perform better, much better than those babies that do not read with their parents. So this is although we already know that shared reading is very important, but this is the first study that showed that on just one book can make big difference. So this is the important advice that you can give to your the family. You can show them that reading just one book can make much difference to their child. And if they do not know how to read with their kids, you can also show them some dialogic reading skills. For example, completion, which means that the parents can read a sentence, but do not read the last word. So for example, the hungry caterpillar is eating, and then wait, and let the child finish the words, or just wait if the child cannot read or cannot communicate with verbally. So we can just wait, and then we can say the last word if the kids cannot use the verbal words. Completion is one of the skill, and another skill is recall. We can ask that what just happened what just happened before this child starting to cry. So we kind of guide the child to think about, oh, what's happening, and that caused the feeling of this child. For example, the kids may think about that the children is crying because someone took his toy, or someone kicked his legs, or the boy is just falling down on the floor. So recall is a skill that we can use when we are reading with kids. They can think about what just happened before this scenario. And another skill is to use the open-ended, for example, some WH questions: what, who, and when. So these are the good questions that you can initiate a dialogue with your children. And another skill is distancing. Distancing is a skill that usually used with kids with better language development, but it can also facilitate their language, because when you talk about some scenarios in the book, for example, you are talking about butterfly, then you can connect your own experience. You can ask that, oh, remember that we saw a beautiful butterfly in the park last week? You can connect this to your own experience or to the child's experience. And then also, you can also ask that, okay, let's think about, in addition to the butterfly, what kind of animals can fly? So this is also a skill, a distancing skill that we can use when we read with child. So those are the skills that you can share with families and encourage them to read one book with their child every day. All right. And some other information that I will encourage you to share with your family is that positive parenting. And you can find those resources on the 0 to 3. This is a organization that focus on children from birth to age of 3, and they have a lot of studies and many resources for parents. You can always find some tip sheet like this. For example, okay, oops, nope. Here. Yeah. So for example, on this tip sheet, they provide nine tips for parents. So these are also some useful resources that you can give to parents to support them to support their children's social emotional development, because we all know that parents has to settle down themselves, calm themselves first before they react to children's challenging behaviors. Okay, and these are some other resources. Let me show you the Oregon screening project. Okay. I need to stop sharing and then screen this one. Okay, here we go. All right, so this is the Oregon Screening Project website. You can find a lot of resources. You can also look at the ASQ/SE questionnaire here. If you want to complete one, you can do it as well. But if you are not doing for a child, then I recommend not doing it because it will kind of mess up their data set. But if you have a child, you can use it. If you have a client, you have a child, then you can use this website to screen their social emotional development. And I want to show you the resources here. Okay. Oh, there we go. Okay, so here are some behavior guides. There we go. So you can see the social emotional development here. You can download it. And you can also share it with the family. There are the social emotional development milestones that they can try to observe when their child reach to this age group. And these are free. You can download it anytime. And they also provide the activity sheet that parents can use at home. So those are the free resources that you can provide to your family, or you can find some resources in Taiwan that is related to social emotional development, because providing those information can help to increase their awareness of social emotional development. Sometimes parents will focus on language or focus on motor development more than social emotional development. But we would like to increase those awareness and try to let parents know that screening and monitoring social emotional development is very important because this is critical to their school readiness and to their further learning experience. Okay. Back to the slides. All right. So try to find some resources that is for social emotional development, and then put in your toolbox when you think that this family may need these resources, then you can have it immediately and provide it to the family. All right, so back to our question. As a professional working in the field of rehabilitation science, I think it's very important that it's important that you need to understand that social emotional development is intertwined with other development areas, especially language area and the cognition. And it also can be influenced by environment and cultures. So this is a complicated and functional process. It's not just a simple area. We need to consider more than that to address the social emotional skills. And you also need to recognize the importance of social emotional development screening, and you need to regularly and ongoing monitoring the development especially for children with special needs, because as we talk about it, that those kids are more likely to have behavior problems, and those problems can be worse after they grow older, and it's hard to improve after they are older. And you also need to be aware that you are a critical team member to provide consistent support for the social emotional development. So everyone on this early intervention team are critical to support the social emotional development. This is why I encourage you to have the general idea about the social emotional development and the ABA. You need to know that there are things you can use, or you can refer the family to access those resources, those service, so the kids can have have the intervention earlier. And also you need to be sure that you are using family-centered practice, because families, as we know that the ecological system, that family is the pivotal role in this system. We want to have family-centered practices to ensure that the plan is working for this family, not just for working for us. All right. So those are the last message I want to give it to you. And thank you for your attention and participation.
Okay, thank you.
Please, yeah, let me know if you have any questions.
Thanks for Declan's wonderful presentation. You bring so much new information to for us that we can know we can play different roles in helping children developing in helping children develop. Now we are going to open the this time to everybody. That do you have any questions? You can raise your hand.
Or you can just type it. Oh, I think I just saw a question here. Does the behavior analysis need the certificated analysis to perform? Yes. Yes, in the US, only BCBA can perform the behavior analysis, but it's only for the function analysis, which is the experiment part. For other people, for other practitioners, for example, the teachers, they can perform the first two parts, for example, the indirect assessment and the direct assessment for the functional behavior assessment. So they can perform the first two parts, but the last part, the experiment part, can only be conducted by BCBA. And yeah, but many of the behavior problem does not need to go into the last step. So many times we can just observe it, and then we kind of know that the reasons behind this behavior, so we don't have to do the experiment. So usually many of the behavior problem doesn't have to go to the last step. All right, the second question is that, is there any subcategories from the results of ASQ, and what is the possible outcomes for children showing clinical significance in ASQ? Are you talking about ASQ or ASQSE? Because these are two different. Oh, okay. All right. So ASQ is, let me tell you that ASQ is overall child development screening, and ASQSE is a particularly screening tool for social emotional development. And the author of ASQ and ASQSE is my advisor in the University of Oregon, Dr. Jen Squires. And one time I asked her why you develop, because she already has the ASQ, and I asked her why you developed the ASQSE after ASQ, because in ASQ they already have some items in the ASQ, but they still develop another screening tool, especially for social emotional development. So she told me that because there's needs in the first, I think she mentioned that the first state government in Hawaii, the government in Hawaii, they said that they really need the tool for social emotional development, because the items in the ASQ are not enough to screening this development area. So they decide to have another independent tools for social emotional development. And you said that you are asking that what is the possible outcomes? I kind of not understanding your question. So are you talking about the category after we score the SQSE? For example, the score will have the no or low risk, and there's a score close to the cutoff. That would be a monitor zone that we need to monitor regularly. And there's also another zone for referral, which is higher than the cutoff. I don't know if you are asking about. Did I just answer your question?
铂金有回答你的问题。
Yeah, sorry, because I'm kind of not sure about your second question.
铂金，你可以直接那个打。
Yeah, can you just talk? Thank you.
Yeah, you can talk. Yeah.
Yeah.
Hello. I just want to know that for the kids, they do have the social emotional problems. So will they develop any other possible disorders or some emotional issues? This is what I want to know.
Sure. Yeah. So because SQSE only provides screening results, they cannot be the diagnostic tool. So when we screen them when the score is higher than the cutoff, that means that they need to go the further assessment, and then the assessment may give them the diagnosis. But the SQSE cannot give them the diagnosis because it's just the screening. But this is an important part too, because it can be done quickly, and we can screen a lot of kids in a short time, and then we can identify them earlier. And yeah, so SQSE cannot provide diagnosis. You have to refer this kid for further assessment after SQSE.
So what if they didn't go for other assessment or other intervention? So what would these kids develop? I want to know that if they are going to develop like a characteristic, for example, poor impulse control, or some other problems.
Yeah, if the kid cannot get the services or the further assessment, usually the problem will get worse. As I said, that a lot of study has shown that social emotional development problems cannot be improved without appropriate intervention, especially for kids with special needs. So sometimes we would like to have further assessment for this kid, even though that the problem may be caused by language delay or may be caused by cognitive delay, but we want to know what's going on, because social emotional development is kind of the overall function and overall performance that we see, but there are so many things behind it to impact this performance. So we want to have the further assessment to identify what's the main issue, what's the main problem. For example, if the main problem is that the child needs more language skill to have a better social emotional skill, then probably language therapy, the speech therapy will be enough for this child. But if the child has for example, some child may show some autism signals early on, then the speech therapy may not be enough for this child. So we want to figure out during the further assessment to determine what kind of services we need to give to this child. Yeah, does that? Go ahead.
I want to explain that why I'm asking this question is that because at the first beginning you talked about the mental problem. There are the prevalence of 20 to 30%,
Yes.
right? And you
Yeah.
asking about if this prevalence is high or low. And actually, I think it is high because that I've in my opinion, I feel that lots of young kids, children, they do have the emotional issues, and this is also part of the mental disorder. But
Right.
now they are. I feel that also, in my opinion, this is
With
not
your
really
observation,
emphasized.
that's good.
Yeah, this is not really being emphasized in our current medical practice. That's because parents always think that, oh, that's how children's behaved, or
Yes. So it's kind of like impacted by cultures, right?
yes.
So in Taiwan, yeah. So because the study we just talked about that the prevalence rate, it is based on DSM-5. So yeah. So how to say so this is the international criteria for to diagnose
understand.
mental
DSM-5 gives
disorder.
DSM-5 gives
Right.
a diagnosis
Right.
about this. However, for the
Right.
kids
Right.
who really have the emotional problem, we don't talk about any disorders or really currently existed disorders. But for the kids who have this kinds of the emotional difficulties, I think that's more than the prevalence.
You think it's
in
more,
my opinion,
So it's also, so in your opinion, for example, you have your own cultural backgrounds, right? And other families, they have their own cultural backgrounds. They have different expectation on the behaviors and also the way they regulate their emotions. So what I would suggest is that we need to increase the awareness. We first need to increase the awareness that social emotional development is very important, and kids, they do have this kind of problem. But right now in Taiwan, what I know is that many families, although they know these terms, but they probably do not get the idea what social emotionally exactly is. So I think this is important as a practitioner in early intervention, that we need to send a message to families that, okay, this is social emotional development. This is the idea, what it look like, and what we need to look at, and how can we screen it. And if your child is already in early intervention, we encourage the family to screen social emotional development regularly. Yeah. So I think right now in Taiwan, the first thing is that we need to increase that awareness. Yeah. And this is why I encourage the practitioners in rehabilitation science to understand those basic ideas and work with each other, because it really takes a whole village to support social emotional development. We need to make a very consistent and holistic intervention to make sure that it works in every setting. Okay, and I think I just saw another. Yeah, thank you for your question. Great question, thank you. And I just saw, how does the background in PT help in your future work of early intervention and special education? Okay. I think one thing is that I have that medical the medical training, because the training is quite different from special education, and that helps you to have a different perspective when you study in special education, because the mindset is quite different. Yeah. In rehabilitation science, usually we have a very objective mindset, but in special education, they focus a lot on the relationship, and they focus on people themselves. For example, for example, sometimes my advisor or my colleagues, they will think that I'm more disease-centered or client-centered instead of the family-centered, because if you want to really be family-centered, you need to see the family first before you see the child. Does that make sense? So although the PT background is helpful in some way, but you also need to jump out of that box sometimes to really see the family first. Yeah, but looking at the children itself is also helpful, especially when you are doing the ABA, because ABA is kind of between the rehabilitation science and between the special education, is like in the between. And then I think it's really helpful that I have those two backgrounds and work in ABA field. Yeah, so yeah, it helps me to be objective. Yeah.
Thank you. I think you have already answered my second question.
Really? Okay.
Okay.
Well, those they have the risk. Oh, okay. Oh no, it's the coaching. Oh, what did you find the most
I think you
challenging?
already answered it. Does anyone have questions? 硕士班同学如果没有办法用英文提问，你可以用中文，没有关系哦。
用中文也可以。
对 ，It's okay to communicate with Chinese Mandarin.
Yeah.
OK.
我可以问一个问题吗？
可以。
现在就是很流行，一定要用英文上课吗？
Because we have international students. Yeah.
Oh,
we
I
have
see.
students from
Okay.
Thailand and Malaysia. So I think it will be better in English communication.
Okay. I see. All right. Yeah, that makes sense. Because in National Normal University, they also have many international students. Yeah.
Yes.
Yeah.
Thank you.
硕
士班的同学，如果你有问题想要提问，可以用中文，没有关系哦。Okay, I think everybody's still digest the mass information, so I think the time is really late. So let me close this talk, and thanks for Angeline's presentation today.
Thank you for having me. And one thing I want to okay. So everybody still can see the slides, right?
Sure, yes.
Okay, yeah. So if you have any questions or you want more informations, I include the reference here and the resources here. And hopefully it is helpful for your practice in the future when you work with families and the child, and if you want to address the social emotional development. And I really hope that a lot of practitioners are aware of social emotional development, and eventually Taiwan can include a screening tool that specifically screens social emotional development. Yeah, I just feel that I need to kind of broadcast and spread the information. Yeah. Right. Okay.
Thank you so much. Yuting, should we take a group picture?
Yes. Please turn on the camera, everyone. Yeah. 开始吗？好，那我要截图喽。
Okay.
3, 2, 1, 2, 3。
Yay.
老师，你可以先帮我共用停止一下吗？停止共用。
我不会耶。
Oh, I can do it. I can do it.
对。Yeah. Okay. 好。1, 2, 3。3。OK，谢谢大家。
Thank you, everybody.
OK，谢谢哦，谢谢方宇，那你就不再耽误你的时间了。对啊，改天有机会回来台湾我们再联络。
应该你们在美国也可以来玩，拜拜。
好，拜拜。